everyone, welcome back. Today I am joined by Dr. Mary Grimberg. She is a pelvic and orthopedic physical therapist out of Austin, Texas. And today we're going to be talking about how she manages different types of pelvic floor impairments and issues. And I'll be popping in here any minute now. Sometimes Instagram is haunted and the connections are a little bit challenging. So if it doesn't work, we will see you again another day. Now we're better.
Oh my gosh.
Hi, Dr. Mary. Welcome.
Oh my gosh. I was like, no, we're not going to be able to do it. I was trying so hard. It kept saying no request was not sent.
We live to Instagram another day.
We're here. We're here.
Well, thank you so much for joining us. Do you want to start by telling us about your practice in Austin, Texas?
Sure, yeah. So my name is Dr. Mary Grimberg. I am an orthopedic and pelvic floor physical therapist. And I started my practice back in 2018. And so I've been heavily an ortho-based physical therapist for many, many years. Did a lot of advanced training and residency and you name it. And I felt like there was a certain amount of people were just not getting to that next level because it wasn't focused on understanding the pelvis and pelvic floor and how that interacts with the hip, the back, the ankles, and everything up and down the chain. And so I added pelvic health to my practice a few years ago because there was this huge missing piece. And so ever since then, I've just fallen in love with pelvic floor physical therapy because I love talking about taboo topics just because I know that a lot of people, my thumb reaction just popped up here. I love talking about taboo topics and helping people feel comfortable with symptoms that they're experiencing that aren't ideal and maybe they don't feel comfortable talking to people about. And so that's a lot of what I talk about too in my podcast as well. So I have a podcast called Sex and Wellness with Dr. Mary. But for the practice itself, we focus on a holistic mindset too. So mind-body connection, looking at the entire body from head to toe, understanding how the foot can affect the pelvic floor and everything, even from the thoracic spine as well. And so we like to address it from the whole person, not just the symptoms, because what I've been finding is, as we were talking about before, this is a crazy world we live in. And so the nervous system being really heightened and not helping people understand different ways to help regulate the nervous system, help understand how their physical and emotional pain can be interlinked, and just understanding how their body works. And what I find with that is more control or more autonomy over their health so they can ask the right questions. And so my health journey is pretty extensive, but in 2019 I was diagnosed with cancer, and I'm fine now. Had to do chemo and all of the things, but what that did is it leapfrogged me into this holistic approach to healthcare and not just Western-based medicine, because I saw there was a big gap between, okay, we can help the symptoms, but what about me as a person, right? And all these other aspects of life that I'm juggling as well. And so that's also another reason why, Resilient has become a trauma-informed clinic to help people that may have been traumatized by the healthcare system or have a history of PTSD and help them feel safe in our space to optimally heal.
That's incredible.
Yeah.
Because when we train patients to know the right questions to ask about their provider, giving them a gift that empowers them for life. So
it's the single-handed thing that I've found that just takes people to the next level, because you can go in, we're not the clinic. You're going to come in, you're going to get clamshells and, these like basic, not like clamshells are bad or anything. It's more of everything you get, you're going to understand why you're getting it. It's not this cookie cutter approach. It's more of, hey, this is why we're doing this. And then teaching them kind of intuitively how to understand, hey, maybe we give them a certain, I don't know why.
Dr. Mary, you're a party.
What is going on today? Apparently fireworks. And so for them to intuitively teach them to understand how to intuitively, maybe adjust their exercises or maybe focus more on breath work before doing the exercises to kind of get that maximum effect, or start understanding how different aspects of their life can be affecting their symptoms as well.
Absolutely, because all of those things can further drive symptoms. So if we're only managing from a narrow canal of exercise or manual therapy, we're going to get only so far. I mean, so far, there's great evidence behind all of those things, but helping to manage the entirety of the person is really imperative, especially in pelvic health.
Oh, for sure. I mean, yeah, manual therapy and exercise are a huge component of it because it pulls you into your body. But then, you know, what other aspects of life, like for instance, if you're dealing with chronic pain and in every other aspect of your life, you're working 14-hour days, you're not able to ask for help, or I find a lot of times it's, as I struggle with this myself, is boundaries, understanding how I can't give if my cup is empty. And so how to refill my cup, because that helps my nervous system and that helps my body heal. So then I can give to others. And there's this expectation sometimes in our culture for women to just give with, kind of infinitely. And what you're finding is chronic pain, chronic anxiety, just debilitating symptoms and autoimmune diseases, right? You're just kind of, it's like this whack-a-mole. What I find is that's happening because we're looking at it from just the symptoms. The symptoms are a result of a bigger piece, right? And so how to get people to kind of recognize that themselves and teach them about their bodies, so that way long term they leave us knowing, hey, I've learned a lot. I try to tell people it's more of an investment long term, so that way you feel empowered and you feel good and you can ask the right questions to your next healthcare providers and you can feel comfortable advocating for yourself. So yeah.
I love that. What intimate rose tools do you find yourself utilizing in conjunction with that holistic approach with education and manual therapy and exercise as part of the comprehensive plan of care?
Yeah, the two ones that I use the most are going to be the wand. I find when we're working with pelvic pain, like chronic pelvic pain, right? Pelvic tension and releasing, well, I'll show people how to release those muscles with the wand. And then also with, we use the vaginal weights a lot. So the vaginal weights to help with urinary incontinence and sometimes even just for biofeedback to kind of feel those muscles contract, because people might feel, oh, I don't know if I'm doing it. And how do I know if I'm doing it at home right? And so that the vaginal weights are that instant feedback so they can feel, because it will fall out, right? And so you're getting that feedback. And so those two have been super great. I mean, we've used pretty much all of the products that you guys have, the tools that you all sell, but those tend to be the most frequent. And I like using the vaginal wand to help people release those muscles, but then as they release those muscles, right, kind of thinking back to, okay, well, what maybe even was there something physical or emotional that occurred leading up to that pelvic tension or that pain? And so then we can release it with the physical pain, right? The physical tension with the wand, but then also understanding, okay, well, what situation maybe led up to that tension, right? Was it a change? I'm not a psychotherapist, but get them to kind of recognize these patterns and then either address it in therapy or work through it with their therapist, and just starting to recognize those two, so that way the symptoms become less as well. But I find that those are the main ones that we've been using.
I love that. Something that a lot of people aren't aware of is that before we made really comfortable, soft, and bright, pretty vaginal weights,
Yeah.
the original inception was in the 1980s, and it was a metal cone, and the original purpose was for proprioceptive input. And I still hold strong and true to that being one of the primary features that makes it a solution, is that it brings attention and awareness to the brain where a muscle group is that they really can't see and they can't reach and they can't access easily, and we're training the brain to locate it in service of rebuilding strength and endurance and all things, so that it carries over into their functional life as well.
Yeah, what I'll tell people too is, sometimes it's like what you're saying is sometimes it's less even about the physical strength and more about the feedback. And so I'll tell people, hey, if you have two cell phones, right? Like one cell phone has all the gadgets and everything that you want, but it doesn't have connectivity. It doesn't matter. Like, say maybe, I don't know if you experienced that huge, massive outage with like the internet a few weeks ago. Did you guys get that?
No, we've had our share of others though.
Well, all of Texas internet was down for like a few days a few weeks ago. And so it's like, it doesn't matter how fancy your laptop is, how your phone, whatever. If you can't connect, right? And so that connectivity is the brain.
Yes.
And so if we can't get that connection, then it doesn't matter how strong your muscles are. You can do those things all day, but you're not improving that pathway. And so I just tell people it's basically the brain connecting to the pelvic floor. And the more that you improve that, it starts as maybe like that connectivity, maybe like a gravel road, and then it becomes a 1-lane highway, and then a 2-lane highway. So basically it's that neuroplasticity paving the way for you to recognize, oh, that's what I'm targeting. And I think a lot of people think, oh my gosh, I'm not doing it right, or I don't know what I'm doing. Why can't I feel this? And it's, well, to be honest, we're not taught about any of this, and we're taught to kind of ignore it and don't talk about it. And so when that happens, we experience dissociation of the area, and then naturally we don't get that connectivity. And so my goal is to kind of improve that, and then the weights kind of help, oh, that's it. That's right there.
Absolutely. What's one of the biggest misconceptions that patients have maybe when they first start pelvic physical therapy?
I would say that, well, number one, I think there's a few, if I could say a few.
Yes.
They assume that you have to have had a baby. And I am here to say that that's not the case. I think that it's been promoted that way, which is, it's super helpful postpartum, but there's so many other people that are dealing with a variety of symptoms that, have nothing to do with having a child. And so there's so much more there that can be helpful beyond just having children. The second thing I would say is I think people think that it has to be an internal treatment the entire session. And what I find is when it's that for like 60 minutes of an internal, I've seen that too. And we'll do an internal assessment and then show everything kind of external. So that's why I think that orthopedic piece is huge. So it's not for us, it's not a huge part of it because I get a lot of information on that internal assessment initially to do that. But also, you don't have to do the internal assessment, especially if you have significant history of trauma or recent trauma or sexual trauma. I'll say, hey, we can wait. We can do everything subjective. Like I can get a lot of information subjectively, and then with that external assessment to help people feel comfortable. Because I find that is also a piece that keeps people from coming. Because they're like, I've had bad experiences, maybe an aggressive pap smear or bright lights and loud noises and all the things. And so at our clinic, I've intentionally made it so it's a quiet space, warming colors. It doesn't feel like a hospital. And you get to choose whether or not that's something you feel comfortable with versus sometimes people feel like it's rushed and forced and then they get re-triggered or re-traumatized. So I'm very intentional with making sure people feel comfortable in whatever phase of life that they're in with that.
So important and such a tremendous service to provide in that way.
Yeah, I'm very passionate about trauma-informed care because of my history too. Like I said, my cancer history, I've dealt with chronic fatigue for 20 years and was gaslit a lot with that. And then I do have complex PTSD from previous history in childhood and things like that. And so what I've been craving myself is a safe space to be heard, to be listened to, and for my boundaries to be respected. And so I just wanted to create a safe haven for people that are like me, that want that space. And I find that a lot of times people avoid care because of being re-traumatized by the healthcare system.
Absolutely.
Mm.
And you and I had this conversation previously about we get to be the ones to stop the train. When
To
there's
be
a
the buffers.
train cracking through, we get to be the ones to put a stop to it there. And you're doing that in your clinical care and as a person.
Yeah, yeah. Life's hard and healthcare shouldn't be. And so, like, the healthcare experience shouldn't be. And so, I will say it till I'm blue in the face, is just providing that care. And just, it's thinking about all of the senses, right? When you think about walking into, like, a hospital system or maybe a bright office, you got these fluorescent lights, which the bright fluorescent lights, right? And then loud noises. So we've already got two senses overstimulated when our base is already stimulated, right? So it's just compounding on top of it, maybe a rushed assessment, and then it's the muscles can't relax, and then there's a lot of moving pieces. It's just compounding this nervous system response that I've even had it where I've had it, a pastor was so rushed and I was like, ow, oh my, like, ow. And then they were like, wow, that shouldn't hurt. I'm like, okay, now that's messed up because now I feel like, I don't know if I can curse on here, but
Yes.
now I feel like an asshole for expressing my emotions of pain. And you're like, am I nuts? I think I just deserve like a simple, like, acknowledgement that, okay, go slower. And so, thinking about these different things, and then like colors of the space, brightness, sounds, smells, all these different things. I try to nurture that in the clinic so that way the starting base of us starting is a lower, like a nervous system that's not as heightened, which, oh my gosh, like then the muscles can relax a bit more. Then the healing can really start because we can't heal in environments where our body thinks we're being chased from a bear. They just can't. We are meant to survive that situation. Like that's our body goes into that fight or flight mode. But if we stay in that, we can't heal. And so the more that we can provide these environments collectively as physical therapists, as healthcare practitioners of, hey, let's keep these things in mind when we're working with people, because that helps take them to this next level of healing. It's pretty incredible when you start kind of paying attention to it. And I don't blame anybody when they're not doing it because it's not even taught in the healthcare system. And so, like, the more that we can talk about it. And an example I had the other day, I was doing a televisit with a provider and said some symptoms I had, and they were like, whoa, I've never heard of those symptoms in all the years that I've practiced. And I was like, and then I go, I know you didn't mean it like that, but that makes me feel like I'm broken. And I just wanted to give you that feedback because I know you didn't mean it, but just to be aware of it for the future because, does that make sense?
Yes, it does. And it also makes them look silly.
Yeah, I was like, okay, well, I'm aware enough to know that these symptoms are real. But what if I wasn't? What if I was somebody else? What if I was already in a shame spiral and then I had that conversation?
Because it
That,
made you like
yeah,
you're so out of the norm. My goodness.
I never. It's just like, oh gosh, like that doesn't feel good, but okay. So it's just being aware of the environment, how we speak to people. We're all human, we're all dealing with stuff, and how to make it an optimal space for healing. And then that's where the magic happens. It's really beautiful when it's incorporated or even just noticed, right? And then the more you start looking at these things and noticing them yourself, you're like, oh, okay, like I get it, And I like to explain it to people as like, if you haven't, if you don't, for the longest time, first of all, I didn't think I had a history of trauma. I was like, oh no, I'm good, But I had all the symptoms of it: the heightened nervous system, the severe anxiety, this like kind of hypervigilance, right? And what I'll tell people is, maybe if you haven't experienced it as a healthcare practitioner, thinking about like if you've ever been over caffeinated, that feel the best way to describe it is like over caffeinated, and every single sense is like heightened, right? So like sound, touch, smell, all these things, you're gonna be like, ah. So it's like when you're in those moments, how to kind of bring it down.
Bring it down.
Dial it down. Turn the knob down. And this is especially important, as we were talking before, is like being in an election year, is just what can we all do? We are more connected than we think we are. And we have a lot more love and connection and kindness to give to each other. And that when everything's fighting here, that there's love and kindness up here. And so just kind of being like, where are we all similar, and how can we all connect together to understand that, hey, we can rise above and we can do this together.
I love that.
Yeah.
What parting thought would you like to give to people?
I would just say, if you're having symptoms and you haven't gotten an answer, you're not crazy and you're not broken. It's just you haven't gotten the answers. And unfortunately, the way the things are set up right now is that our system helps with acute symptoms. It doesn't, Western medicine is heavily based in acute symptoms. So if you break your leg, right, like that's when you want that help, right? Or you have an active infection and need to take something. If you've been dealing with chronic symptoms for many, many years, that's when I'd say lean a bit more into Eastern medicine and just kind of look at how the two can blend so beautifully and help give you answers. Because they're both kind of like, I feel like both sides kind of poo-poo on each other. I'm like, again, let's blend. Let's blend. So you're not crazy. You just haven't found the right answers yet. Keep going, and you're not broken.
I love it so much.
Yeah.
Thank you so much for your time and your expertise. I really appreciate you coming on and sharing your wisdom.
Well, thank you for having me. I appreciate it. And like I said, I love what you guys do, and I'm appreciative of you all as well.
Thank you so much. And I hope to see you in February, perhaps at CSM when it comes to Houston.
I guess I should sign up for that. Yeah.
Speaking of sensory overload.
It's like, oh, let's add on that too.
Yeah.
No, I just renewed my OCS this year, so I have my APTA membership. So
Yay.
I should be able to go. Especially it's Houston. It's like 2 hours away.
Yeah. It'll be a good time, and congratulations on renewal. I just had to renew my 10-year pelvic health certification as well, and that was a long test.
Yeah, it was a lot of paperwork, but it's I like having, if people don't know, orthopedic certified specialist is what the OCS is. It takes a long time to get it. And I feel like it gives me a lot of like street cred for being a pelvic floor PT. So I was like, I'll just keep it. And I eventually want to do some teaching in the future to kind of help. Again, I'm all about blending ortho and pelvic floor. So
Love it. Wonderful. Well, thank you so much, Dr. Mary, and I look forward to seeing you.
Oh, thank you so much. All right, bye.
Bye.